Part D provides coverage for prescription drugs. It's only offered through private insurance companies, and it has a formulary of generic and brand name drugs that they cover. So make sure when you choose your plan, you make sure that the drugs that you're using are on the formulary. Otherwise, that'll be a lot of out-of-pocket costs. And also find out if your pharmacy is a preferred provider or standard. If your pharmacist is standard, then your co-payments are higher.
Mm-hmm.
So yeah, so Part D, you don't have to. It's not mandatory, but some people decide to stay on original Medicare and not have a Part C plan, but they need help with prescription drug coverage, so they can enroll into a standalone Part D plan.
Well, definitely, it does become, an issue. So a lot of times people kind of miss out on that, and also there's a late enrollment for this as well. You want to touch on that?
Remember when I touched on there's a late enrollment fee for Part B? Well, there's also a late enrollment fee for Part D. If you do not have a qualified prescription drug plan, then you will be charged a fee. So that's another reason why many people they get a Part C plan, because since most Part C plans include prescription drug coverage, then you avoid that penalty. However, if you don't have a Part C plan and you don't have any other qualifying prescription drug coverage, then make sure you enroll into a Medicare Part D plan during your initial enrollment period.
Perfect. And so Audrey touched on the preferred versus the standard. A quick example would be, for example, Aetna is, they're linked with CVS. They're, I believe, under the same parent company. They're, tied. They're similar companies. They're under the same umbrella, corporate umbrella. So obviously, Aetna will prefer that you get your prescriptions from CVS. So if you go to your local pharmacy and they're not, a preferred provider and they're a standard provider, you're going to pay sometimes a lot, sometimes a little bit more, because Aetna has, obviously, they want more of their patients and their clients to go to CVS as opposed to the mom and pop pharmacy that's nearer to them, or the ones they have a relationship with. So that's something to think about. With the 2025 Inflation Reduction Act for Part D, um, I spoke a little bit ahead. I was just so excited to share the news, so I said Part C, but it was really Part D. But with Part D now, because of the Inflation Reduction Act, the maximum out of pocket, so that's the most that a person can spend out of pocket on a prescription drug plan, is actually $2,000. Now, that's in a single calendar year. So you cannot pay more than $2,000 if you're a senior or if you qualify for Medicare going from 2025 onward. Um, what does that mean? Well, that means that, now people can actually spread out their payments. You don't have to pay everything at once. So that was a big issue a lot of times for seniors who have limited income. You go in there and, there's a drug that costs, let's say, $800 on the formulary, right, Audrey? We've seen that.
Right.
And,
Yes. Right.
it's like, whew, that's a large bill to just have to bite the bullet on. Well, now you can
Right.
actually break it up throughout the year. So that's something that is part of the Inflation Reduction Act that was
Right.
brought about by the changes in policy. So that's something that's there. Audrey also talked about credible coverage. If you're a business owner, if you're working in a company, if you have your employer's health insurance as opposed to signing up for Medicare right now, you have to make sure that their health coverage is considered credible. That is the prescription part of their health coverage. Because if the prescription part is not credible, you will not the health coverage that your employer provides for you is not going to be seen as credible. So when you fully retire and you want to walk away and get on Medicare, because you'll have a different you'll have a special enrollment period. Audrey touched on it a little bit in terms of, and we'll do a separate video about enrollment periods, when you can join Medicare. What are the exceptions? Well, you have a certain window. You're 3 months before you turn 65, the month you're 65, and 3 months after. If you don't enroll within that window, you will be penalized for it. However, if there's certain exceptions. One of those exceptions are people who are working and their employer has credible coverage, so they have 10 employees or more, and their health
20
coverage
employees or more.
20, pardon me, yes, 20 employees or more, and their health coverage covers up to or above what the Medicare standard is. Well, now that the maximum out of pocket for a Medicare plan for the prescription part can't be above $2,000, that means a lot of employer-based health plans for seniors who are working will no longer be credible. So now you have a decision to make. Do I stay on my employer's health insurance and most likely run the risk of having to pay a late enrollment penalty when I'm ready to retire?
Mhm.
Or do I reach out to a genius person like Audrey, right? You're going to be in safe hands, and she'll put you on a plan, and then they can run the numbers, check your providers, make sure everything is okay, so you can get on Medicare and you don't have to worry about that late enrollment penalty. But again, it's all about running the numbers and doing these feasibility studies and working with you on a one-to-one basis. So, Audrey, is there anything that I missed out that you want to add?
No, I'm glad that you pointed that out because a lot of working seniors are like, "Oh, I'm still working," and it's kind of confusing if they should enroll or not enroll.